Hi, welcome to Prakriti Sports Science and Physiotherapy Clinic. I am Harshada Rajadhyaksha and today I am going to speak to you about water. I am going to speak about all aspects of water to do with health, and towards the end I am going to give you some general tips and advice on how much water you need to drink each day, etc. As usual, there will be some scientific reasoning behind everything that I say. So today's talk might be slightly longer than usual. Please stay with me till the end. Water is hugely important for our body and for our survival. We can stay for a few days without food, 3 weeks actually, but for really less time without water, just 3 days. So isn't it strange then that we feel hungry several times a day and we can also get tempted with food every time we see it? But we don't necessarily get thirsty several times a day, and we certainly do not get tempted every time we see water, right? In fact, most of us have to remember or have to be reminded to drink water a few times a day. So if we do feel thirsty, what it means is that our body has already lost a little bit of the percentage of water that it is supposed to have. So what percentage of our body is actually made of water? Most people would quickly say 70% because that is the general belief. But that's not perfectly right. Our bodies are made up of 50 to 70% water, but that changes throughout our life. Babies have a significantly higher water content than adults. And also interestingly, the more fat mass you have, the lesser water percentage you have. And that is because fat doesn't have much water. It's just 10%. And that is also why babies have a much higher water percentage than adults. That is because they have much less stored fat than adults do. So the leaner you are, the higher your water percentage, even if you are an adult. So let us say that an average adult has about 60% of water in their body. Now these water stores are stored in different organs at different ratios. Blood is very obviously liquid, and so it must be made up of water. 91% of blood is actually water. Muscle has 75% water. Fat, like I just told you, has 10% of water, but we would say that fat is kind of a softer tissue and might have more water, but it only has 10%. Whereas a harder tissue like bone also has 30% of water. Water has several crucial functions in our body. It transports nutrients and important gases like oxygen and carbon dioxide to each and every cell. Water is required for the making of every cell and also for the making of hormones. Now, hormones are really important. They are the signaling system of our body, and they are the so-called action directors of everything that our body does. Water is required for regulating heat by the sweating mechanism. Water is required for protection of every organ, including brain and the spinal cord, for excretion of urine and stools. And in fact, water is part of that inbuilt detox system that we have, which literally and meticulously every day clears our whole body of all the toxins that we ingest. Water is also required for shock absorption to prevent the wear and tear of all our joints and ensure their smooth functioning, lubrication of joints, including the spinal or the vertebral joints. So if water is so crucial for the proper functioning of our body, how much of it should we drink each day? You'll hear all kinds of advice ranging from 1.5 liters to 3, 5 and even up to 7 liters a day. But logically speaking, if our body already has all the water it needs, and believe me, our body is this incredible machine which is provided with everything it needs for its functioning and survival. So our body already has all the water it needs. All we need to do is to replenish the loss that it has every day. Because think about it, would you really want your body to store water? Our body doesn't store water. It uses the water that we drink to replenish its losses, and then it excretes everything else. If you drank more water, would it better detoxify your body? Would it flush out those toxins better? Again, no. Because our body filters out, our kidneys actually filter out 180 liters of blood each day. And remember, I told you 91% of blood is water. So our body already has all the water it needs to flush out those toxins each day. All we need to do is make sure that we keep that percentage as it is. So we have to replenish the fluids that we lose, but beyond that, more water has no extra function in the body. Drinking more water each day would just mean flushing out the same toxins in a lot more urine. So let us talk about water loss. An average adult loses approximately 2.5 to 3 liters of water each day. And of course, this will depend on the environment that that person lives in, the humidity and the heat around him. It will depend on the body size, the exercises or activity levels, health conditions, and also age. Because older people lose much less water than younger individuals. Also, some choices that you make might influence the amount of water you need or you lose. If you eat more protein, fiber, or salt, you will lose more water. If you are in an aircraft and if you are flying even 2 hours, you will lose about 250 ml of water in those 2 hours because of the low humidity in the aircraft and the controlled atmosphere. Also, if you are ill, if you have fever, if you have nausea, vomiting, diarrhea, you will lose more water. So if you lose between 2.5 to 3 liters of water a day, you also need to drink 2.5 to 3 liters of water a day, right? Well, again, no. Because remember all the beverages and liquids that you have, tea, coffee, juices, soft drinks, milk, buttermilk, etc. The foods that you eat, some of them have much more water content than others, like soups and broths. In India, dals, curries, and kadhis. The vegetables and fruits that you eat, some of them have a lot of water content, like oranges, watermelon, cucumber. But even the seemingly harder vegetables, like broccoli has 91% water. So you get a lot of water from the foods and the beverages that you consume. You get close to 20 to 25% of the water that you lose from the foods and beverages that you eat. Now, some people will say that tea and coffee are diuretics, so we cannot count them as fluid replacement. Diuretics are things that cause the kidneys to produce and excrete more urine. And yes, tea and coffee are diuretics, but their diuretic effect is short lasting and some part of that fluid also can be counted as replacement. So what you need to drink is between 1.5 to 2 liters of water a day. So 6 to 8 large glasses of water a day. And just like you do not lose all the water at one go, similarly, please do not drink all this water at one go, spread it out throughout the day. So what about all the advice that the more water you drink, the better it is for you? Or that you should wake up in the morning and have 1 or 2 liters of water before you do anything else. Is this good advice? Is there anything like drinking too much water? Or is drinking too much water actually harmful to you? Well, it can be. So while drinking too much water may not immediately be harmful to you, if you drink it at one time, you may end up losing water-soluble vitamins, minerals, salts and electrolytes through your urine. Also, if you do it for long enough, you are likely to overburden your kidneys as well as your heart. Drinking too much water is not at all desirable or required for your body. If you understand the thirst and the satiety after thirst signals that your body sends you, you will understand why I am saying this. When you are thirsty, your blood concentration of salts has reduced by 2%. You are not dehydrated, but you are in a danger of getting dehydrated. So your body is trying to preserve itself by sending you a signal. These signals are generated in two places. One is in the mouth and throat, and the other is in your blood. The blood volume and the concentration of salts in the blood will send a signal to your brain to tell you to drink. When you are thirsty and when you have that first glass of water, it is extremely pleasurable, right? But quickly after you are done with that one glass, that pleasurable feeling might turn into an unpleasant feeling. This is satiety. This signal is generated purely from your mouth and throat. Because remember, the water that you have drunk has not yet reached your blood and changed the volume or the concentration of that blood. This is your body's self-preservatory mechanism telling you to stop drinking or to prevent overhydration. Now compare this to the feeling of being hungry and the satiety that comes after you have eaten. When you feel hungry and you eat food, the food has to reach all the way to the stomach and actually occupy space in the stomach, and then the signal will go to the brain to say that you can stop eating. But even after that satiety signal has gone to the brain, you can still continue eating without feeling unpleasant, and in fact you might even get tempted with more food. Not so with water and thirst. Once your thirst is quenched, you will not get tempted with more water, and in fact if you force yourself to drink more water, it will be unpleasant. Now this is your body's self-preservatory mechanism in place, and that is because overeating is not necessarily and immediately as harmful to the body as over-drinking or over-hydration. So our body has this self-preservatory mechanism right in place there to keep us safe. All we have to do is learn to listen. One way to tell if you are drinking the right amount of water is to check the color of your urine a few times a day. If your urine is light pale yellow in color, you are drinking the right amount of water, you can continue. If your urine is darker in color, if it is lesser in quantity and also stinks a bit, then you are probably drinking less water than you need. Try drinking a couple of glasses more. If your urine is almost colorless, and also if you end up going to the loo a few more times than the others around you, you are probably drinking too much water and also maybe losing a few vital vitamins. Try drinking a couple of glasses less and see how this goes. But please remember that a few medications and especially supplements might already color your urine, and then this advice may not work. Finally, some general suggestions, some tips and advice. First of all, choose real foods, fruits and vegetables. They will give you water. They will also give you the vitamins and minerals that you need. Stay away from highly salty and processed foods. They will make you lose water. Drink between 6, 8 or 10 large glasses of water each day. Of course, this depends upon your age and body size, the exercises or activities that you do, your medical history, and also the environment you live in, the heat and humidity around you. When you drink this water, do not drink it at one time, spread it out throughout the day. When you are thirsty, choose water. Do not quench your thirst with salty, sweet beverages or with alcohol. If you are constipated and regularly so, try drinking 1 extra glass of water each day. It may or may not help you, but it's worth a try. If you choose to exercise, and even if you're exercising for 30 minutes indoors, add 1 glass of water. If you are exercising outdoors for 30 minutes, 1 glass before and 1 glass after. And if you increase the exercise intensity, the duration of the exercise, then add as many glasses in between as you need, but at regular intervals. Also, if you have a swelling in your legs or maybe even all over your body, if you have high blood pressure or if you have any cardiac disease, then please meet a doctor to get evaluated. Do not use overhydration as a remedy. If your body is finding it difficult to get rid of excess water, then you might have a medical problem. You will need a consultation. Try to listen to the signals your body is giving you. There is so much information available to us. Whenever you decide to follow any advice, try to find out the scientific reasoning behind it before following. That is all for today. I hope you liked this video. Please subscribe to our YouTube channel, follow us on Facebook and Instagram, share this content with your friends and family. Bye. See you soon. Stay safe.